Good evening. This is Charles Patton. I'm your people's counselor. And I am here representing Tacts, the Association of Clinical Trial Services. And once again, we are here to have our discussion around health equity. We're going to continue to push this particular agenda until we get what we need. If you haven't heard the last few shows, our primary focus has been promoting health and making sure that we as a group of people, we as individuals, get the kind of health care and services that we need. All right? So once again, let me just show you all what we've been addressing for the last few months. Okay? If we can hold on one second. Okay. We are talking about with diversity comes a cure. Increased diversity in clinical trials. Now, what does that mean? It means that people of color is not getting what they need. We are being treated with information that's been accumulated on other people. So we have to start getting involved in these clinical trials. We have to start getting information that will be better for our optimal health. We must continue to push the paradigm. We must continue to push our legislators. We must continue to push the agenda and research if we are going to reach optimal health and getting what we need. Okay? So once again, with diversity comes a cure. All right. So with diversity comes a cure. And I just want to acknowledge some of our sponsors. We got the Third Coast CFAR, Men and Women in Prison Ministries, the AIDS Foundation of Chicago, the National Black Consortium, Gender Consortium, AHF, and of course Flow Photography and Enterprises. Now, with this next slide, we are going to talk a little bit about healthy living skills. Now, what does that really mean? Healthy living skills. Okay, there are some things that we as a group of people, particularly black people in America, have been suffering from, and I'm sure you all have heard this once before or several times. You know, when we talk about being disproportionately impacted by these conditions. It has been my experience that knowledge is the key to being free. So we're going to have to make sure that we get correct information. If we are going to get our optimal health, we're going to be able to live healthy and have the healthy living skills that we are entitled to. All right, so my next push is going to be talking about not just the health equity as far as medical care, but what about access to good nutrition? You know, I know you all have heard about the term food deserts, and we've been hearing it quite a bit lately. Fortunately, in recent months, we've been seeing a lot of farmers markets. So it's imperative that we get that information, get to those markets, get some affordable quality food, because that is paramount to us getting the nutrition that we need and having the health that we need. Because if you can't get access to good food, you can't get access to good health care, you can't get access to good physicians, then we are going to be continuously behind the curve, or behind the 8 ball, if you will. So we need to start looking at healthy living skills. And this is a promotion that's been put on by the Men and Women in Prison Ministry as well as Flow. And we're going to talk a little bit more about this health equity paradigm, right? Now, if you had a chance to see this particular slide, if you notice on one side, and this is what we've been pushing for the last few months, you see one where everybody got the one box. That's what we call equality. But if you look at the other side, you'll see that the taller individual has no boxes because he doesn't need any to see or to get what he needs. The second individual has one box, and the third individual has 2 boxes. That is what we call health equity. That is what we call getting what you need, not an umbrella or a blanket approach to health care. Unfortunately, I am a counselor by trade, and we are dealing with these services in this managed care industry, or this managed care day, where things have been somewhat what can I say, streamlined, for lack of a better term. And what that means is that they are paying for services that they deem that meets medical necessity, not necessarily what the client needs. And for me personally, it has been a nightmare. Now, I'm sure you all can call in and give me some of your stories and experiences. I would appreciate some other dialogue. You can call in at 312-738-1060. And we can have a discussion so that we can set up an agenda so that we can go and push those people that's representing us so that we can get to that health equity. For those that need the 2 boxes, we want to make sure you get your 2 boxes. For those that need access to some quality food, we want to make sure you get some quality food. For those that need access to appropriate and some doctors that has a ability to reach you and not talk above you or think that you are less than they are, we need to have those discussions so we can push this agenda. So please call in 312-738-1060. And now with that being said, I want to talk about Recovery Month. For those that don't know, this is September 2018. This is what we have been deemed for the last 29 years as Recovery Month. For people that are suffering from chemical dependency, from people that are suffering from mental illness, from people that are suffering from a whole host of other conditions that I will show you a slide on in a few moments. But this is Recovery Month. So we want to talk a little bit more about what that means. All right? And if you look at this particular diagram, health equity requires that we do some policies, some services, and some data research. Okay? Now let's get into Recovery Month. Now, if you see this slide, the theme for this month or this year is Invest in Health, Home, Purpose, and Community. Invest in health, home, purpose, and community. That is what we are talking about when we're talking about optimal health. Right? It requires you as an individual, it requires your home, your community, and everybody that's involved in that, and of course, making sure that we are on purpose. We need to make sure that we advocate for ourselves, because 9 times out of 10, those that won't get what they need. Okay, so once again, this is Recovery Month, and just to keep with the theme, I've had some of my recovering brothers and sisters post their dry dates. So I just want to share with you from my particular experience. My dry date is May 16th, 1989, and it's truly by the grace and the community that I surrounded myself with to give me those amount of years of not being afflicted with the disease of active addiction. Okay, so truly, we can recover, but we have to make sure that we get the things we need. Once again, health equity. Okay? Now, at this next slide, it just kind of gives us a brief history. 29 years ago, Recovery Month highlights the achievements of individuals who have reclaimed their lives, long-term recovery, honors of the treatment and recovery services who make recovery possible. Recovery Month also promotes the message of recovery in all of its forms and possibilities, encourages citizens to take action to help expand and improve availability. Effective prevention, treatment, and recovery services for those in need. As I stated once before, working with this managed care system has been somewhat of a challenge. You know, I do advocate that people have insurance. What I don't like is that the insurance companies are able to dictate what service you get, not based on what your needs are, but based on, for lack of a better term, income or financial abilities or the willingness to pay. So until we start to push them, then we're going to continue to be marginalized in getting the stuff that we need. Okay? So with that being said, I want to promote the Recovery Walk. All right, this has been sponsored particularly by Danny Davis, and it'll be the Saturday, September the 22nd. If you got the time, I would encourage you to get out, get involved, and truly share your story with somebody else, because we know that sharing our experiences, our strengths, and our hopes help other people to recover as well. Okay? So truly, you want to get out there September 22nd. It'll be in Garfield Park. And they also are doing these Special Olympics. Okay, so go out, help the people, support the people, tell your story, and truly help promote this Recovery Month aspect. There are some other things that we need to take a look at as well. Okay? If you look at the next slide, we are talking about Recovery Month. I know it's a little difficult to see, but I'll read it off to you. It is International Day of Peace will be September 21st. We got the Recovery Walk September 22nd. Also recognized in the month of September is Pain Awareness Month. Now, let me focus on that for a minute. Pain awareness. I know you all been watching the news, and if you haven't, then this is what's going on. We are in the midst of what's been deemed an opiate epidemic. And primarily is what's happening is that we got these big pharmaceutical companies promoting these pain medicines, pain management medicines, and unfortunately people are becoming addicted and then finding themselves in trouble. I know for the last couple of weeks at the organization that I work for, we've had at 8 o'clock in the morning 20 or 30 people seeking assistance to get some help with these opiate addiction, and it is getting worse compared to what the numbers are. And not only is it getting worse, it's also we're starting to see that the faces are getting a little younger. So we need to really start to address how we're going to deal with that. And once again, when I talk about healthy living, there are natural ways and other ways that we can manage pain for those of us that's in chronic pain. And believe me, I know a little bit about some pain over the last few years. But okay, so with that being said, we got the Recovery Walk kickoff slides. Now, this is a program that was promoted by SAMHSA. You can always go to their website. I encourage you to seek the information, because once again, knowledge is power. Knowledge is the key to being free. But this series started back in March, and they have a whole set of different topics that they cover. This month, they will be talking about strong communities and strong recovery. All right? And they are determining what date it's going to be aired, but it will be shown sometime before the end of the month. I would encourage you to go to the SAMHSA website, that's samhsa.org, and truly get involved in that information. Get out here and support the cause. And if nothing else, just tell your story. All right, so that we can make sure that we continue to push this agenda. Okay? And then in November, they would do somewhat of a recap, what they call Roads to Recovery, and a showcase of all the events that's taken place since March. So, and I would encourage you once again, make sure you go to the website, that's samhsa.org, get the information. If you are recovering from anything, I got some family members that's breast cancer survivors. You know, I got some other family members that's dealing with some addiction problems. You know, and we are getting better. We are getting better, but it requires us getting correct information. I cannot stress that enough. You know, when you think about the health equity paradigm, it's about you getting what you need. So once again, I would like for you all to join this conversation. If you got any questions, if you got any concerns, if you just want to know a little bit more, you can call in at 312-738-1060, and we can have some discussion and you can share your story with us. Okay, so I'm going to continue to talk about this for the next few months. Me and my partner, Sister Ya, who will be up next to talk a little bit more about about HIV and some of the other things. Okay, but we will definitely have some discussions around this. Okay, so with that being said, I want to show you we are now we are now going into what we call the National HIV/AIDS Aging Awareness Day, which was yesterday. Now, what does that mean? Basically, what's going on is that we are starting to see some of our seniors, 65 and older, showing up HIV impacted. Okay, and based on some of the literature, a lot of them have been impacted for some years, and unfortunately, by the time they do get into treatment, they are already receiving AIDS diagnoses. So there are some things that has to be done. We have to start catching things a lot earlier. And it's not just with HIV, it's with any social ill, any physical illness. The sooner that we know what's going on, the sooner we can do something about it. So let me show you a few of the numbers. Okay? Now, as it states here, why older Americans are at risk? Older Americans are at risk than younger people because generally by the time they are identified, they are getting AIDS diagnoses. By most of us, knowing that HIV is preventable, although the visits of the doctor's office is for older people are likely than younger people, unfortunately, they're not being assessed appropriately because a lot of people think, well, yeah, you know, when you're older, you ain't having no sex. Let's think again. You know, I know y'all done heard about the little blue pill. And unfortunately, once again, I've seen a lot of seniors coming into treatment at the age of 63, 65, 70. You know, that's dealing with this opiate addiction, that's dealing with cocaine abuse, and they are having sex. They are, unfortunately, getting exposed to HIV, and of course, they're not being assessed properly because a lot of the medical community don't look at them as being at high risk. You know, but it's been my experience and my teaching that if you are living, breathing, and you still have some sexual activity and urges, which a lot of us still do, then you are potentially at risk. If you are living and having sexual contact of any form, you can put yourself at risk. And we're starting to see that seniors are becoming a little bit more exposed. Even though the numbers are not as high as other groups, it's still a major issue that needs to be addressed. Okay, so with that being said, I want to talk a little bit more about this healthy living skills. Now, when we think about our mental health, we know that's been one of those topics that we like to keep in the closet. Oh, he's just a little strange, right? But unfortunately, we're starting to see a lot more of those strange people on our streets. And unfortunately, a lot of them look like us. So this is another issue that has to be addressed. Mental health and mental disease, mental illness is real. Depression is real. You know, we all have what we call some down moments. You know, and we don't necessarily get clinically diagnosed. But I know some of the literature that I just read not too long ago talked about adult ADHD. Now, if you're not familiar with ADHD, that's attention deficit disorder. And we have a lot of people who was missed in those earlier years that they normally identify this in children. And of course, that's a whole nother topic because they was being set up when they was put on that Ritalin to be substance abusers or finding that substance abuse can correct things. So that was the wrong message that they was given. But we are starting to see that we are getting some adults who have this condition. You know, I've been in certain areas in the city, and I've seen young men walking down the street having conversations with themselves. Now, for all intents and purposes, we all have a conversation with ourselves from time to time, you know, but sometimes you can tell when it's out of order. All right, hey, we got a caller.
Yes, and good evening to you.
Yeah, good evening.
First, let me compliment you just to say this. Here you took out time today to deliver a message. I mean, you could have been doing anything else, but you took time to come down to CAN TV to give a message.
Yes.
and not one single person has called. And trust me, everybody could turn to the left, turn to the right, look up and look down. You got those people that need help.
Yes, you're right.
You got the right man, Mr. Davis. Danny, he's a wonderful guy. I hate to give names to places, but there's a place that used to be Skid Row.
Right.
And now is $1 million condos down there, and they steady fighting the people from buying that little property. They still want to buy that little property to hold on to help people. Let me tell you something. For the people, I hope that was listening, I hope they give you a call, because it's old saying, and a friend of Bill's will tell you, if you're not ready, you're just not ready. But you got to hurry up and get time, because eventually something's going to happen where if you don't have no money and top-notch insurance, you ain't going nowhere.
You are absolutely correct.
Nowhere. And it's getting more like that day by day. And listen, you're going to have to get some more people to get down Springfield, start lobbying for you, because that's the only way that you're going to get these accessible funds to keep yourself open and to keep on moving.
Yes,
again, for anyone listening that need help, you need to give them your private number, call them, get that help, because not just eventually one day you can't get the help, but one day you ain't going to be able to live in Chicago.
And
so,
you are right, caller. They are definitely pricing us out, and I agree we have to get involved in the politics of this game.
There you go. Listen, I want to thank you for taking the call. Let me get out the air so I can hear your response, and all the luck to you. Keep coming back. If you could just say one, you did your job.
Yes,
Have a great night.
All right, well, thank you for that call, and you are absolutely correct, caller. We have to get involved, and it is a lot of people out here, and I know it's some people listening, that just didn't call in, but I know that we're going to have to come together and get some unity going, and he was absolutely correct. We have to get down to Springfield. We have to get out here on these streets. We have to support the organizations that's doing the work. If it ain't nothing but going and donating some time, or donating a pair of shoes, or donating a few dollars, we have to support the effort, because unfortunately, as he stated, a lot of us are going to be even further marginalized, and it's going to be harder to access treatment. It's going to be harder to access health care. It's going to be harder to access healthy, nutritional food. These are all requirements. If you're not familiar with Maslow's hierarchy of needs, if you can't meet your basic needs, food, clothing, and shelter, then you're in a problem. And I see this happening every day. I'm working with a young lady now who has been taxed out of her home, because of what's going on in this city. I'm working with several clients who are elderly, and unfortunately, with this affordable, or supposed to be this gentrification and mixed income housing, well, believe you, the mix ain't the way it's supposed to be. So we are truly being priced out. I know for a number of years I worked in a place where they had what they call SROs, and those particular housing projects have now been converted to condos. Okay, and unfortunately, those of us that's people of color, once again, are being disproportionately impacted by this particular situation. So it's been my experience that a closed mouth won't get fed. So you need to start to open your mouth, get involved in this process. We need to push for health equities. And once again, I want to congratulate all my brothers and sisters that's in this recovery walk, recovery month, and that you are celebrating whatever you are recovering from, and do it with living well. We want to thank you for tuning in, and once again, we'll see you all next month with our community epidemiologists. And we will continue to have this discussion, because I'm in the fight. As Charlie Wilson would say, I'm in it to win it. This is your People's Counselor, Charles Patton. And I will be talking with you very soon. Thank you.